Dr. Murray here again. No, I'm not playing Shakespeare. However, I'm here today to talk to you a little bit about the temporomandibular joint, also known as TMJ. People will come in and say, wow, I have a TMJ. And I'll actually say to them, well, you know, you do have two of them, one on either side. Temporomandibular joint is, the short for that is called TMJ, temporomandibular joint. The TMJ is a combination of two bones, the temporal bone, which serves as the socket, and the mandible, which serves as the ball. It's kind of like, almost like your shoulder joint, a ball and socket joint, so to speak. It also has a cartilage similar, called a meniscus, similar to what you have in your knee. So people will come in complaining of various issues with their jaw or temporomandibular joint. So what's chiropractic got to do with that? Well, first of all, issues in the temporomandibular joint can come from three areas, or sometimes a combination of them. First of all, it could be a dental issue, purely a dental issue that you need to go to your dentist with and have that figured out. You could have bite problems caused by dental work that you might have had, and if you don't rectify that, you're going to continue to have problems. So you need to get a good dentist who can evaluate the TMJ or your bite for you. So that's important, and we oftentimes refer people to the dentist. But from a chiropractic standpoint, what do we deal with? Well, if it's not dental, it could be cranial issues with the temporal bone itself. The mandible may be out of alignment as well. However, the spine also plays a large role with temporomandibular joint issues. Upper cervical areas of your spine, as well as upper thoracic, can affect the muscle tone into the head and neck. And that can affect the balance of tone that actually causes your jaw to function. The buccinator muscles, the muscles of mastication or chewing can be affected from the nerve supply in the neck and the cranial area. Also, something to consider very much is the pelvis. Believe it or not, if your pelvis is out of balance, your lower back, you can have load-bearing issues. And there's compensations your body goes through with that in terms of how your pelvis moves. When you stop moving throughout the day and you lie down and go to bed, those compensatory movements are then translated to the jaw. Reflexively, the bones of your pelvis relate to the temporal area. So compensations in your pelvis during the day for an issue, a subluxation in your pelvis affecting load bearing, at night will be manifested in the bruxing of your teeth or clenching of your teeth. So you see, the temporomandibular joint it's a complicated issue that has to be sorted out. And, you know, chiropractic's going to look at the underlying cause spinally and cranially. And if there is a cranial issue and we diagnose that, it's a very simple way to adjust you just with gentle tapping with an instrument we have called an arthostem. And it works very well. As far as the pelvis goes, there's various gentle techniques that we use to bring balance into the pelvis. Sometimes that's the underlying cause. So temporomandibular joint, you got to figure it out. Is it dental? Is it cranial? Or is it spinal? So that's how we approach it. So let us know when you come in. We have ouch pads at the front desk. If you're ever experiencing pain in your jaw, let us know. And then we can figure out what might correlate. Okay, so have a fantastic day. Hope that helps you understand what's going on with the TMJ. I appreciate it.